Welcome to Build the Weight Loss Practice of Your Dreams. I'm your host, Carol Clark, and today we are talking about a topic none of us really enjoy talking about, and that is patient complaints. But more importantly, how to make patient complaints more of a thing of the past in your practice. And it is something that's possible. I know I love practices, and ours is like this, where you hear more laughter and more excitement than you do grumpiness or people complaining. And weight loss is one of those things that can make you grumpy. I mean, I don't know about you, but I've struggled with my weight, and it's a terrible feeling. So we want to make sure that we provide an environment where we are celebrating our patients, not not holding them back in any way, shape, or form. So we want to keep patient complaints to a minimum. Of course, there will always be sometimes somebody having a complaint about something, but let's talk first about what are the most common reasons people have complaints, and then we'll address how to avoid having patient complaints, how to prevent them. So we're in the complaint prevention business here. So some of the main reasons why you'll have patient complaints is number one, unrealistic expectations. So this can relate to any process in your practice, whether it's how often you fulfill refills, lab results. It could be something related to how quickly a patient call will be returned, something online. It could be lots of different things, unrealistic expectations about how much weight they'll lose in what period of time. All those things set you up for failure. So we want to be very clear about that and why. So we want to make sure they understand how soon do you return phone calls, what's the best process for getting prescriptions refilled, if you need a lab order, when you're scheduling appointments, how far out, that sort of thing. So we want to make sure that we are realistic in terms of the expectations that people have. The next thing is a lack of follow through. So one of the things that really upsets people is a lack of follow through. If you say you're going to call them, you don't, or you say that you are going to have their back to work note ready and you don't, or you return all your phone calls within 2 hours, but you don't. So we want to make sure, once again, that we are following through on whatever it is that we promise people. We want to under promise and over deliver. That is really one of the greatest ways to prevent complaints. The other thing is a poor online or on-site experience, and their perception is their reality. So it could be just something in terms of how easy your patient portal is to use, or how you communicate back and forth via text or email, whatever your method is. I know our patients love text messaging in terms of, as we're doing appointments, lots of different things. We do so much through our patient portal, and they love it. So, but there's a few other people that's not their thing. So we have to adapt to that. So making sure that they have a great online and on-site experience. So perhaps on site, somebody was in a rush. It was time for them to go to lunch. They had to rush out of the office and they were short with someone. That's a real thing that does happen. And, but it's a matter of explaining that, saying, I'm so sorry, I'm in a rush, but here's, Mary's going to take over for me. You are in good hands, making sure that you address that with them. So making sure that they have a great online and on-site experience. And the other thing could be a poor outcome. I mean, it could happen. And that goes back to what the realistic expectations are, especially in terms of weight loss. Some of the things that you can do to prevent and avoid patient complaints, of course, are to set realistic expectations with them for the processes in your practice, as well as patient outcomes and weight loss and all of that. You want to make sure that you are clear about that. That's why one of the other reasons why we are always really clear about any of our pricing, because we don't want surprises. People don't like surprises. They like to be able to plan for it. If they know up front, they're more than often times they are just totally good with it. They can make their decision and they know it all up ahead of time. So that's just our way, but it does help prevent confusion and sometimes people being upset about something. Asking them for feedback is also helpful at times, seeing what worked really well, what might they improve upon. We're always in the process improvement business, so we want to make sure that we're asking for that. Responding promptly to complaints rather than letting them fester is really important. We're really lucky. We don't really get very many, and I can't remember the last time one escalated to me. But we want to make sure that we respond very quickly. You can sense when someone's upset about something. You just pause and you say, I can sense that you're upset about something. Is there something I can help you with? Making sure that you minimize the long-term festering of that. You never minimize what their concern is, but you want to make sure that you do minimize the overall impact and kind of address it right up front. So you also, as you communicate with them, communication is so important, but you want to make sure that you are listening to them, that you don't, that you do pause what you're doing, that you actually listen to them, you have good eye contact, you take them to a private place to discuss the matter as necessary, and you really do your darndest to fix it right then. And I allow my team to make to help solve things right then. I would rather have it solved right then before they ever leave the premises or get off the phone with one of my team members. I'd rather have it resolved right there than having to wait, come up to me and ask, can I do this? Can I do that? It might involve just a little bit of service recovery. If it was maybe we promised them something and we didn't, someone dropped the ball, we may, provide them with some extra bucks of their favorite bars, or we might just, and you never know, just anything to help them, know that you do care and that you do apologize for any mistakes that you made. So we do need to be honest about mistakes, communicate openly, listen to them, and make sure that they know that they are heard. The other thing is to make sure that you, if you don't know the answer, like I say, that you're going to get back with them, and then follow through on whatever it is that you say that you're going to do in order to help remedy the situation. Now, granted, I know sometimes there are people who just are complainers. And sometimes, we have to employ. The other cool thing about it is I like to have a diverse team. Everybody has different personalities, and sometimes patients respond differently to different personalities. So sometimes one might relate better to one team member, and so we try to coordinate that they're always with that team member, or the team member, if something happens, we let them address it. So there's so many different ways that you could do this, but the bottom line is trying to figure out what is going to be best for your patient. Under promise, over deliver, set clear expectations, follow through on what you say you're going to do, make sure that you listen, make sure you have good eye contact, that you do some service recovery, and that you do ask their opinions as you move along so that you can continue to improve things. So if you follow through on all this, you will find more laughter in your practice than you will complaints. And it also boils down to just having a good attitude and helping your team to do the same. So I hope that was helpful. Patient complaints can be, they're always there, and but they can be really minimized and addressed straight on. So those patients just love coming to your practice and love referring other people to you because they know that they will be very well taken care of. So I hope that helps. And if you haven't subscribed to the podcast, please do. If you're not a member of Barrier to Business Boss, check out barriertobusinessboss.com. And if you just want to have a conversation about something frustrating in your practice, reach out to me, Carol, Karol, at weightlosspracticebuilder.com. And in the meantime, take care.